Disclaimer: We Level Up is not promoting the use of prednisone and alcohol. This video explores dangers and consequences, not endorsement. Learn, don't use. Comment below. Stay safe. Welcome to the We Level Up Treatment Center video series. In today's video we will discuss prednisone and alcohol. Moderate alcohol consumption may be tolerated while taking prednisone. Limiting drinking can be a good idea as both substances may weaken your immune system. Prednisone can affect blood sugar levels, harm your digestive tract, and decrease bone density. Prednisone and alcohol tips and dangers you ought to know include: avoid alcohol while taking prednisone or other steroids. Alcohol can worsen side effects and underlying conditions. Combining steroids and alcohol increases the risk of infections. Older adults may face even more significant risks when mixing alcohol and steroids. What is prednisone? Prednisone is a versatile corticosteroid that can treat many different diseases. Its wide dosing range makes it suitable for different treatment durations as well. Whether short courses or an extended period of use, prednisone can provide relief and healing from inflammation or immune system suppression. Moreover, prednisone reduces inflammation while suppressing the immune system. Prednisone and alcohol use. Can you drink alcohol while taking prednisone? Prednisone's label doesn't provide a clear answer, and clinical studies are lacking. However, prednisone affects metabolism, which may alter the body's reaction to alcohol. Dosing, treatment length, and medical conditions should also be considered to determine if it's safe to mix alcohol with prednisone. It's best to consult with your doctor. Prednisone and alcohol effects. Combining alcohol and prednisone can lead to complicated and potentially harmful side effects. Both substances suppress the immune system, making it harder for your body to fight infections. Those with an elevated risk of acquiring type 2 diabetes may also experience increased blood sugar levels. If you consume more than 1 or 2 alcoholic drinks daily while taking prednisone, you are at a greater risk of developing diabetes. Alcohol and prednisone may upset the digestive tract and increase the likelihood of developing peptic ulcers. Additionally, prolonged prednisone use while regularly consuming excessive alcohol can raise your chance of developing osteoporosis. Stay safe by avoiding alcohol while taking prednisone. Furthermore, prednisone lowers the body's immune response, and drinking alcohol can weaken the immune system, making a person more vulnerable to infections. Hence, it's best to avoid drinking alcohol while taking prednisone. Consult a healthcare provider with any questions or concerns regarding taking alcohol and prednisone, or other medications. Adverse prednisone and alcohol interactions. If you wonder, can I drink alcohol while taking prednisone? Mixing alcohol and prednisone can cause serious side effects exacerbated by drinking. Adverse prednisone and alcohol interactions may include changes to blood sugar levels, damage to both the stomach, GI tract. Dehydration accompanied by electrolyte imbalances is a possibility. Development of type 2 diabetes due to impaired immune system function. Muscle weakness. Mood swings might also occur. High blood pressure could develop, leading to slower wound healing. Osteoporosis, weakening of bones. Pancreatitis, inflammation of the pancreas. Suppression of adrenal glands is a further concern. Weight gain. Impaired immune system, wound healing. Suppression of the adrenal glands. Mixing prednisone and alcohol side effects. Methylprednisolone and alcohol side effects. Prednisone treatment increases the risk of side effects, especially with higher doses and longer durations. Dosing, treatment length, and alcohol consumption are critical in intensifying the adverse effects of mixing prednisone and alcohol. Can you drink alcohol on prednisone low dose? While some may be able to have an occasional drink with low-dose prednisone, it's crucial to consult with your doctor. Although the FDA doesn't warn against drinking while on prednisone, it's essential to be cautious due to its effect on the immune system and potential interactions with alcohol. Ultimately, abstaining from alcohol while on prednisone treatment is the safest option. Regular and excessive alcohol consumption is never recommended. Both alcohol and prednisone have individual side effects, and when used together, they can increase the risk of adverse interactions. Here are some of the side effects of alcohol and prednisone. Side effects of alcohol. Slurred speech. dizziness and lightheadedness, impaired judgment and coordination, nausea and vomiting, hangovers, risk of addiction, increased risk of accidents or injuries, side effects of prednisone, stomach upset and gastrointestinal problems, mood changes and anxiety, muscle weakness, increased appetite and weight gain, changes in sleeping patterns, increased risk of infections, increased blood sugar levels and diabetes, high blood pressure. When alcohol and prednisone are used together, the risk for gastrointestinal bleeding, stomach ulcers, and liver damage also increases. Talk to your healthcare provider before consuming alcohol while taking prednisone or other medication. Prednisone and alcohol dangers. Prednisone and alcohol can have dangerous interactions. Prednisone is a steroid medication prescribed to reduce inflammation, suppress the immune system, and treat other medical conditions. Alcohol is a depressant that can cause sedation and suppress the central nervous system. Mixing alcohol and prednisone can lead to several complications, including increased risk of gastrointestinal bleeding. Both prednisone and alcohol can aggravate the lining of the stomach and intestines, leading to ulcers and bleeding. Increased risk of liver toxicity. Prednisone and alcohol are processed by the liver. Drinking alcohol while taking prednisone can lead to liver toxicity, which can cause liver damage, liver failure, or other liver-related problems. Weakened immune system. Prednisone is prescribed to suppress the immune system, while alcohol consumption can weaken the immune system. Mixing alcohol and prednisone can increase the risk of infections and other illnesses. Worsening of medical condition. Consuming alcohol while taking prednisone can also worsen the underlying medical condition the drug was prescribed to treat. It is generally suggested not to consume alcohol while taking prednisone. If you have concerns about alcohol consumption while taking prednisone, you should discuss these concerns with your doctor. Prednisone and alcohol precautions. Taking prednisone and alcohol can be tricky, but following simple tips can make all the difference. To get the most out of your medication while avoiding potential risks, keep these tips in mind. Take prednisone with meals to avert an upset stomach. Always consult with your doctor before taking prednisone while pregnant or breastfeeding. Check with your doctor before receiving vaccinations while on prednisone. Never stop taking prednisone unless a doctor advises it. Talk to your doctor about whether potassium or calcium supplements might be necessary. Eat nutritious, well-balanced meals to maintain weight and control your blood sugar. Avoid stimulants like caffeine, which can worsen insomnia, a common side effect of prednisone. Following these simple guidelines allows you to enjoy a healthier, more comfortable experience while taking prednisone and alcohol. When can you drink alcohol with prednisone? If you must drink alcohol while taking prednisone, you should do so in moderation and only after consulting with your doctor. Keep in mind that consuming alcohol may also worsen the condition that you are being treated for, as it can cause dehydration and inflammation in the body. It is always best to follow your doctor's advice and make informed choices about whether or not to consume alcoholic beverages while taking prednisone. Nevertheless, it's not recommended to drink alcohol when taking prednisone, methylprednisolone, or any other corticosteroid medication. Alcohol consumption can increase the risk of stomach irritation and bleeding, which are already possible prednisone side effects. Both alcohol and prednisone, methylprednisolone, can cause dehydration, and combining them can further increase the risk of dehydration and potential health problems. We Level Up provides the highest quality of care, offering clients the best chance of healing and long-lasting recovery. We encourage anyone suffering from a disorder alongside addiction to seek help from a qualified treatment center. If you need help, call us today. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.